Welcome everyone. I'm Sophia Bano from Wellcome EPSRC Centre for Interventional and Surgical Sciences, University College London, and I'm presenting our work titled FetNet, a recurrent convolutional network for occlusion identification in fetoscopic videos. Twin-to-twin transfusion syndrome is a fetal anomaly affecting identical twins sharing a monochronic placenta, which results in unbalanced flow of blood between the two fetuses. As a result, the donor may experience much slower growth compared to the recipient, while the recipient is at a risk of heart failure. Fetoscopic laser photocoagulation is a common treatment for this syndrome, where a fetoscope is an endoscopic device with a much smaller form factor that is used for ablating the blood vessels and regulating the blood flow to the two fetuses. Fetoscopic laser photocoagulation is a minimally invasive surgery during which the surgeon first visually explores the placenta using fetoscopic camera to identify the vascular anastomosis sites, followed by localizing these vessels or the target vessels and using a laser tool to ablate them. A safe procedure requires clear view of the placenta and clear path between the ablation tool and the target vessels. However, fetoscopic environment can be very challenging, mainly because the visual conditions are quite varying and at times quite poor as well because of low resolution, low illumination, amniotic fluid turbidity. There can also be occlusions because of the presence of fetus or because of the presence of working channel port. Also, there can be reflection or a glare because of specular highlights. By automatically identifying fetoscopic events, we can assist the surgeon during the TTTS procedure. This can also provide us context for navigation and mapping. In this work, we have created 4 event labels that include clear view when the placenta is clearly visible, occlusion that could be because of the presence of fetus, or because the camera is too close to the surface, presence of tool, and presence of tool while it is operating. Note that some of the event labels can coexist, as in this case, occlusion and tool both are present in this particular frame. We propose a recurrent convolutional network for spatiotemporal identification of fetoscopic events. The overall block diagram of our proposed network is shown in this figure, which consists of 2 modules. For each input frame, a convolutional neural network is used for encoding the spatial cues by using a VGG16 network as backbone for obtaining the CNN features. Sequential data in fetoscopic videos carry contextual information for event categories identification. Therefore, a long short-term memory recurrent neural network is used for encoding the temporal data. To handle multiple coexisting labels, sigmoid activation is used to get independent prediction probabilities. Pre-trained weights for VGG16 networks are available, but the later layers are initialized randomly and need significant update compared to earlier layers. Therefore, we use differential learning, which implies that smaller learning rate was assigned to the earlier layers and relatively larger learning rate was assigned to the later ones. In terms of dataset collection, we had 7 fetoscopic videos from 7 different patients available to us. Average duration of each video was about 800 seconds. We performed frame level manual annotations for each event. Some example frames from these 7 videos are shown in this figure, where you can observe the variation in terms of lights, appearance across different subjects, and also you can note the variation in terms of occlusion as well. For quantitative analysis, we perform 7-fold leave-one-out cross-validation and we perform comparison of our proposed method with existing methods. That includes fetoscopic ablation detection method, CNN feature extraction followed by an SVM classifier, fine-tuning of the existing VGJ16 pre-trained network, fine-tuning of this network followed by temporal smoothing, our proposed method without differential learning, and finally our proposed method with differential learning. This table reports the precision recall and F1 score of the methods under comparison for the 4 event categories, namely Clearview, Occlusion tool, and ablation, and also give the average value of these metrics. From this table, we can observe that FetNet with differential learning outperform existing methods, giving an overall F1 score of 87%, which is much better than the other methods. The precision recall curve on the right-hand side is in line with these results, where we can see that the FetNet with differential learning gave an overall area under the curve of 0.89. Next, we quickly go through some of the qualitative results, where the ground truth labels are represented in magenta, predicted probabilities are represented by red, green, and blue histograms, and the predicted labels are represented by red, green, and blue histogram with yellow fill. Our proposed method is represented with the blue histogram. This slide shows examples of single label per frame, where on left we can see clear view and occlusion interlacing, and on right we can see tool and ablation interlacing. From these histograms, we can observe that our proposed method is the most consistent compared to the 3 methods under comparison. This slide shows examples of multiple labels per frame, where on left we can see occlusion and tool categories coexisting, and on right we can see occlusion coexisting with tool or ablation. Again, from these histograms, we can observe that our proposed FetNet with differential learning outperform the existing methods. To conclude, we propose FetNet architecture for automatic identification of occlusions in fetoscopic videos. We perform 7-fold cross-validation and comparison with the existing methods, and show that our method outperformed the existing methods, giving an F1 score of 87%. Online testing of our method gave a frame rate of 114 frames per second on a GPU. As for future work, FetNet can be integrated into real-world systems for automatic event identification, which can facilitate the surgeons in challenging visual conditions. Clearview video segments obtained from FetNet can be used for designing field of view expansion methods. With this, I conclude my presentation. Thank you so much for your attention.